You've been seeking answers from every dermatologist, doctor, and all over the internet wondering what on earth this unbearable skin issue is. You know something's up, and you've been suffering and silenced for far too long. This podcast is going to bring awareness to the brutal reality that is topical steroid addiction and withdrawal syndrome. It will give you practical mental and physical tips to help you along your journey and provide you the strength you need to push through each day. You'll hear from real people battling this illness, as well as experts in the field, and I'm also going to share with you what's happening as I battle and conquer TSW. You are not alone, you're not crazy, and you will heal. If there's one thing I know, it's that anyone going through this hell is a warrior. My name is Jennifer Powers, and I welcome you to TSW Journey to Healing. Hello, how are you? It's been a second since I've done a solo episode, and I promise you this one is going to be worth it, so stick around because we're going to talk all about IV ozone therapy, something that I had been trying. I did a couple sessions, back in I want to say March or April, or both, and what I found, what I learned about it, how it may be beneficial for you, if it's something that makes sense for you to try in your own personal health journey and healing journey. And we're going to talk about all of the things because ever since January, ever since the new year of 2023, December would have been a year in. So right around month 13, I started seeing really, really great improvements with my TSW. And it's just gotten better and better and better. And now that we're in spring, almost summer, I'm just filled with so much gratitude, and I want to share with you all the things. So the next couple staggered episodes in between some interview episodes are going to be me sharing some of the things that I had been trying during those months where I saw a lot of great healing take place. And, it may be just disclaimer or like alert or whatever you want to say. It may not, we're never, one of the frustrating things is that we're not going to know what one thing or a couple things or many things are attributing to our healing, even if it's a rapid rate of healing, whenever that starts to happen. We don't know if it could be stress, which I personally believe is the number one thing which causes the slowdown of healing or the lack of healing. Managing your stress is just so important in everything in life, not even just TSW. But we also don't know if it's the time, if our body's just cycling and working through the poison that was all those years of steroids or however long you took steroids for. Everybody is different. We are all totally different DNA, different, everything about us is different. So it can feel frustrating, but also it should give us hope that if, don't compare yourself to anybody except who you were yesterday. Don't even do that because you don't need to compare at all. You just need to be hopeful and prayerful and just fill your mind with good stuff. So let's get into this episode, shall we? Let's do it. So as you maybe have heard on one of my previous episodes, I was starting to do some IV nutrition therapy. And so if you haven't checked that episode, go check it out because that was really awesome. Again, I don't necessarily know if that was helping me with my TSW, but it definitely felt great. I got a hydration IV drip, which was magnesium and, oh goodness, a whole bunch of other things. Go listen to that episode. I remember listing it all out there, but it was great. It gave me a burst of energy, made me feel really good. I added like a G push, which was a little push of glutathione at the end of the IV. There's B12 in there, a whole bunch of good stuff, right? Well, while I was there, and this was at it's called a hydration wellness center, I was overhearing, I saw somebody's IV bag and it looked like it was filled with blood, which was kind of alarming. And I'm sitting in a chair for, 45 minutes and the person across from me had this blood bag. And so I said, what is up with that? Is that what I think it is? Is that blood? Like, what's going on? And she began to tell me it was this IV ozone therapy. And shortly after that, the nurse came over and was giving me this whole conversation, whole explanation about what ozone therapy is. Okay. And so just to give you, again, I'm not a doctor, disclaimer there, of course, I'm just going to share with you what I was told. And, of course, as with everything and anything, go do your own research, look it up. I will tell you, if you look anything up, you're going to see, oh, this is the cure, this is the answer, this is amazing, this is good stuff. And then you'll also equally see, this is terrible, this is bad, you can die. That's with like everything, right? Same thing here. And there are different ways to administer ozone, and some of them can be dangerous. The way that this was done and explained to me was very, very safe. And I'm going to explain that to you right now. So let's first start with, what is ozone? Okay. Ozone is a natural gas. Apparently, I think it was discovered in the 1800s, I think around the 1840s. And scientists believed that it was just another gas in like part of the Earth's makeup. Okay. But the ozone has been found to have all these sorts of medical implications, and actually started to do more and more research over the years, and they have discovered that it actually can help with a lot of diseases and a lot of health problems. So people started paying more attention to it, and it became very interesting. So let's talk about what conditions ozone therapy, IV therapy, has been claimed to be able to treat, and what's the whole process like. So the way it can be administered, and the way that I got it administered to me, was through a specific injection and an IV. So what ended up happening was they took about, I think, 30 milliliters of my blood out. From that point, they took my blood in the back room. They infused the blood, like administered the ozone, the oxygen or the ozone, into the bag. Then they shook the bag a little bit, not too aggressively or anything, but just back and forth, so that it mixed in with my blood. Then that blood bag with the ozone was then administered back into my arm in my IV. So took my blood out, then put it right back in, but with the ozone. So now you're thinking, okay, like what does that do? Well, apparently, ozone therapy done this way can help with so many things. Things like joint pain, wound healing, which, if you have TSW, there can be lots of open wounds from our clawing ourselves, scratching, and so on and so forth. But it's also been known to treat diseases like immune disorders, breathing disorders, diabetes. Apparently, it can kill bacteria and viruses, which also can lead to eradicating some diseases. And so the list goes on and on and on. I was also told by the nurse there that it is very, very popular with cancer patients, people that are undergoing chemotherapy. It can really help their healing process and, get them on the right track. So in 2018, there was a study that found out that ozone mixed with blood and then injected back into people significantly reduced their viral load over a 2-year period. So a lower viral load means less of the virus present, which can improve your long-term health. So I thought these things were very, very interesting. And the feeling that I got, obviously, it's like a needle, so it wasn't painful or anything like that, just the same that you'd expect when you get an IV or get blood taken, things like that. The whole process itself, the prep work takes, decent amount of time, but the bag itself, the drip, the IV, going back into it only takes about half an hour. So it's relatively short. How I felt, apparently some people could feel, if they're a little woozy from IV in general, they could feel a little bit lightheaded, or I didn't feel any of that. I felt absolutely fine, because other people also can feel amazing right when it gets injected back into them. And I felt good. I didn't notice anything bad, nothing crazy good. It was just pretty normal, but more leaning on the good side. I was feeling very good about it. And maybe, one of the reasons I was feeling really good is because they also let me know, along with the many benefits that it can give, it can actually take a sluggish immune system and give it a boost, give it the boost that it needs to function on a whole different level. It also can restore your energy levels and increase your feeling of wellness, which is exactly what I experienced. Ozone therapy also helps with the production of antioxidants, which inactivates free radicals, reducing all the oxidative stress caused by them. And when you reduce oxidative stress, that keeps you feeling young and vibrant and energetic. And it's so many benefits. And it also can slow down aging, apparently, at a cellular level. So, and all aging starts at the cellular level. So as a result, this IV ozone therapy can be apparently one of the best anti-aging treatments possible. Now, if you're like me and your TSW has done a number to your face, and I say that with love and tenderness. But I always had a pretty young looking face, and the wrinkles and the premature aging that can come with, geez, like all the, all the thinning of the skin and the scratching and just the whole plethora of side effects and things that we experience while going through TSW. Well, that weighs on a person's self-confidence. And I thought, well, that's not the reason that I was doing this IV ozone therapy, but if it's a perk, that's great. Bring it on. So another thing that I was told is that ozone therapy works on the cells to cause a disruption of the natural replication process of harmful invaders in your body. So basically, it can inactivate bacteria, viruses, fungi, yeast, and a bunch of other things. So it really, really is very beneficial for immune diseases, which, in our case, a lot of us that are going through TSW, we got here because of sometimes an autoimmune disorder, eczema, psoriasis, you name it. And so this would just make really a lot of sense, right? To really help us at that root level. And scientists actually discovered that IV ozone works on over 100 other diseases and illnesses, and it acts as a disinfectant and a sterilization device when it's used on like surfaces. Now, I didn't get that done, and there is other ways, like I said earlier, about it. You got to be really careful if you look this up. One way, a friend of mine, an old friend of mine, when she saw this on my Instagram, when I shared that I was, and maybe you've seen when I was sharing on my Instagram story about this, she actually told me she got it done, but they administered just the gas directly. It's called like rectal ozone. So you know what I'm talking about. So I even said to her, oh, like I heard some, not so good things about that. That could be very dangerous. And what was explained to me by the nurse who was administering my IV, she said that is very risky because administering the ozone, it's a gas directly into the body, that can be really scary. That can cause, a whole bunch of issues. I won't get into that because, again, I don't have experience with that. I did not do it that way, but you can look that up. Just be very aware. Make sure you go to a great place or ask a lot of questions or call on the phone ahead of time. Make sure that you're understanding every single thing. And I really enjoyed this. Now, I got a set of 3. I spaced them out 1 week apart. You can see they recommend at least 3 treatments. 6 would have been great, but it's quite a pretty penny. So here in the United States, I'm based in Pennsylvania, and it was like, I think $250 US a session. So that can add up. And of course, these things are not covered with insurance and things like that. So all these alternative medicines and treatments that we may really want to look into that can benefit us, we just have to do our due diligence, our research, and we have to make sure that we have the means to do it. So I hope that this was informative. I definitely encourage you to look into ozone IV therapy. I probably would have continued to do it if it wasn't super costly. But I believe in all the things that I have added to my toolbox or treatment arsenal, whatever you want to call it, since 2023 hit. So from January, February, March, April, May, I've tried many different things. I'm a fan of all of them. And like I said, I've been doing so much better. So thank you, God, for that. And I will continue to share the few other things that I have been doing. So just to let you know what's coming up in some other episodes, I'm going to talk all about parasite cleanses. I'm going to talk about castor oil packs, and talk about a whole bunch of other things that I've been trying that I absolutely am convinced have sped up my healing big time. So stay tuned for that. If you want to be on the show, feel free to go to tswjourneytohealing.com. Look around somewhere on the page, but you should see like a podcast application or interview application. Feel free to fill out that form. We'll get you booked on an episode, and just really, really appreciate you so very much for being here. And I'm sending you all the healing prayers and good vibes. And please continue to share the show. I love you. Stay well. Oh, P.S. Be sure to check out the blog post article on this exact topic where I go into so much more detail It'll be linked in the show notes. Feel free to share it with your friends and let me know. Let me know in the comments or reach out and let me know if you're trying this therapy or treatment or any of the other treatments that we've shared on the show. I'd love to cheer you on and hear how your experience has been. Thanks so much for listening. Please remember to subscribe, leave feedback, and share the show. Together, we will spread awareness and bring an end to topical steroid withdrawal. Don't forget to check out helpful resources on the blog and be sure to grab your copy of the one and only TSW journal at tswjourneytohealing.com.